Welcome to session 8 of Foundations of Global Health. Today we'll be discussing hot topics including decolonizing global health. During this Foundations class, we've talked about a lot of issues in global health, starting with the global burden of disease, including the epidemiologic and demographic transitions that are occurring around the globe, health and human rights and ethics, global health governance, including discussing UN agencies, non state actors, specifically non governmental organizations, business and corporations and foundations, and including even civil service organizations. We've also talked about global health financing and have stratified it via basically individuals that fund global health, individuals that manage, and then the recipients or individuals that also affect or actually turn that money into specific action. And then we've talked about specifically USAID and other organizations, including the G7, G8, and G20. And then we've talked about country level financing. Now we understand the global health structure and how it's basically it's composed, including the principal actors. We're now going to critique the global health system and talk about specifically what has emerged over the past few years and has gained momentum within the past couple of years, which is the concept of decolonizing global health. And we're going to talk about it in terms of both the United Nations and the current global health system as it exists, and critique how this system exists. So previously, I showed this figure in terms of the flow of global health financing. So what I showed, I discussed, for example, all sources showing, for example, Australia, Canada, here are the countries, organizations including the Gates Foundation, other governments, other sources, private philanthropies, and for example, the US, and how these sources flowed, the channels where they flow to, for example, the Global Health Fund, other non governmental organizations or foundations, other bilateral agencies, United Nations agencies, and then where they went to in terms of, for example, child health, HIV, malaria, maternal health, and other different health focused areas. So, this is a very complex graph, and we discussed this in other sections. Now, this is data from the Institute for Health Metrics, which basically follows this. And this was from 2019 in terms of $41 billion in US 2019 US dollars, showing the flow of global health financing. So this shows the complexity of global health funding. But we're going to really critique this in terms of where this money goes, in terms of development banks, the priorities of this money, and who basically has a say so in where this particular money goes, and why this money doesn't go to certain areas, but it goes to other areas. And then also, interestingly, there is some sort of money that is actually unallocable. Before we start our conversation on decolonization, and before we even define decolonization, let's look at the Sustainable Development Goals, right? So these SDGs will achieve health related targets. There are 17 of these. And they will cost up to 134 to 371 billion per year over current health spending. The Millennium Development Goals were projected to cost over 40 to 60 billion to achieve their intended goals, but we didn't reach those. So the price tag is about $58 per person each year, and this was pre COVID. So, global health priorities are focused on communicable diseases and not on NCDs, as I've shown previously. So, it begs to differ. We know that based on statistics, that communicable, that actually non communicable diseases are what is starting to increase. But the priorities are on communicable diseases, actually. But the question is there a better way to achieve better outcomes for people around the world? That is truly the question. Now, the question is, and should people who these SDGs are affecting have a say so? Many people who are living in low middle income countries on how much of this uh, billions of dollars are being spent. That is truly the question. Before we talk about decolonizing global health, we have to talk about the classical definition of decolonization. The classical definition stems from the United Nations and the colonization that occurred to formerly independent nations. When the United Nations was founded in 1945, some 750 million people, nearly one third of the world's population, lived in territories that were dependent on colonial powers. Those colonial powers tended to be European countries, namely France, Spain, um, the United Kingdom, and other European countries. Today, fewer than 2 million people live under colonial rule, and in the 17 remaining non governing territories, which include mainly islands within the Caribbean or Pacific, there is a wave. Uh, there has been a wave of decolonization that occurred, and that wave changed the face of the planet. And that was born from the UN, and in fact represents the world body's first great success. As a result of decolonization, when born out of the creation of the UN, many countries became independent and joined the United Nations. I'm going to show a video.
The colonial powers and their supporters try to justify in humanitarian, economic, social, and cultural terms.
This colonial system was imposed by force on many peoples of many races and religions.
And we're continuing to try and solve the problems with the methods that are available to us.
Join us in our efforts to eradicate colonialism in all its forms and manifestations from the face of the earth.
We've ushered in a new era of hope and great optimism.
Since its founding, the United Nations has been engaged in decolonization processes around the globe. And that work continues today, as 17 non-self-governing territories remain. The United Nations will continue to assist, but all should play their role. The administering powers, non-self-governing territories, member states, and the Special Committee on Decolonization.
When the UN was formed at the end of World War II, 72 non-self-governing territories and 11 trust territories were identified as under the control of administering authorities. In 1994, Palau, the last remaining trust territory, gained independence, but as of 2020, 17 NSGTs yet remain. Today, the majority are islands in the Caribbean and Pacific. The United Nations remains steadfast in its efforts to end colonialism around the world. Let's take a look at a quick history of the United Nations and decolonization. Chapter 11 of the Founding Charter of the UN addresses the issue of non-self-governing territories directly. It highlights the responsibilities of the administering powers to promote the well-being of the inhabitants of the territories and to develop their self-government. It also obliges administering powers to give information about their territories to the Secretary General. This is reflected in annual working papers prepared by the Decolonization Unit in the Department of Political and Peacebuilding Affairs. Beginning in the 1960s, the General Assembly's resolve to support decolonization strengthened even further. A series of resolutions were passed that sought to assist the peoples of the territories to achieve self-determination according to their particular circumstances. The first, Resolution 1514, has come to be known as the Declaration on Decolonization. Further resolutions identify the ways in which peoples of these territories can achieve self-government. They include becoming a sovereign and independent state, free association with an independent state, integration into an independent state, or the emergence of any other political status freely determined by the people. The Special Committee on Decolonization is commonly referred to as the C24 because of its original composition of 24 member states. As a subsidiary organ of the UN General Assembly, the C24 is devoted to monitoring and making recommendations regarding NSGTs. Today, the C24 holds regional seminars on decolonization in either the Pacific or Caribbean every May. And for 2 weeks in June, they hold a substantive session in New York to examine the situations in the territories in depth and the issue of decolonization in general. These meetings allow the C24 to hear views of the NSGTs, the administering powers, and other stakeholders and petitioners on the decolonization process. The recommendations that come out of the substantive session of the C24 are submitted to the Fourth Committee of the General Assembly, which in turn considers the recommendations and submits draft resolutions and decisions to the General Assembly plenary for adoption at the end of the year. Additionally, institutional support for NSGTs from UN entities, specialized agencies, and international organizations associated with the UN is important and kept under consideration by the C24 and the UN Economic and Social Council. With the consent of the administering power, the C24 can dispatch a visiting mission to observe conditions on the ground and gather first-hand information. These visiting missions enhance the capacity of the United Nations to assist the peoples of the non-self-governing territories. Recognized as an important tool, the General Assembly has requested that the C24 undertake at least one visiting mission per year. As an example, in 2019, at the territory's request, the C24 sent a visiting mission to Montserrat, still recovering from a devastating series of volcanic eruptions that began in 1995. The visiting mission held meetings with key members of the government, representatives from civil society, and other stakeholders. In this way, the C24 is able to report on the needs of the territories. When the United Nations was established, 750 million people, nearly one-third of the world's population at that time, lived in territories that were dependent on colonial powers. As of 2020, nearly 2 million people continue to live in non-self-governing territories, the majority of which are on small islands that face the added challenges of sea level rise and increasingly destructive natural disasters. While major strides have taken place, decolonization continues to be a priority for the United Nations. Through determination, perseverance, pragmatism, and continued cooperation and coordination, the United Nations is committed to the complete eradication of colonialism.
The UN video painted a very interesting picture in which it showed a very compressed and narrow sliver of decolonization efforts from the UN. I think that it was an interesting video and it didn't give a very broad and painful history of decolonization efforts, at least in parts of Africa, which were very, very painful. Um, from that perspective, we can move forward in terms of discussing more of the colonial legacy. Now, what we can say is that even though when the countries decolonized, the colonial vestiges of decolonization has returned. For example, in many countries, in mostly all countries, you can say, even though colonization and they had left in terms of the colonial powers, the language, the architecture, and many of the systems that have been in place since colonization still remained in place. For example, most countries speak their formal language that was introduced by their colonial powers. For example, English, French, and Spanish. In Africa, you find that being the main language of commerce, and many other countries in South America and in Asia too, as being the main language that's being used. So from that effort, we come to decolonizing global health. So the perspective of decolonizing global health is that particular point that I have raised, that even though countries have gained independence, those vestiges of colonization in terms of the colonial mentality, the unequal access, the power structure, and the power dynamics still remain. And that is what needs to be actually decolonized in terms of global health. So these are two screenshots from two conferences that occurred. One from on the right that occurred from Harvard, the T.H. Chan School of Public Health that occurred in 2019 called Decolonizing Global Health Conference that held in February of 2019. Right after that was one that held at Duke's University Center for International and Global Studies. Same thing, Decolonizing Global Health, that held in January 31st, 2020, which was actually held almost a year after the Harvard conference. In terms of the conference that was held at Duke University, um, the organizers of the conference started to articulate what decolonizing global health was about. And this is a summary of what is on the website, and the URL for the website is below. Um, so basically, they said global health as we know it today, in our research, our practice, and our programming, is the newest configuration of what was once called tropical health and colonial medicine. And tropical health and colonial medicine was meant to keep the colonizers basically healthy, and it was not really meant to benefit the indigenous people who were basically living there when the European powers came. Yet in our most Yet in most major institutions and organizations today, global health is practiced in a depoliticized and ahistorical manner. Oppressive roots of global health, such as colonialism, slavery, racism, are often hidden by a focus on interventions that alleviate human suffering. As a result, many global health practitioners and researchers, despite good intentions, perpetuate the very systems of oppression in which colonial medicine was embedded. This conference was born out of a desire to organize folks, students, activists, academics, practitioners, researchers who are passionate about global health but may find themselves at odds with the uncritical and depoliticized nature of its institutions. So, in many ways, these students wanted to start the dialogue to critically assess the historical roots of global health and where it came from in terms of tropical health, colonial medicine, and really start thinking about sort of how we're doing things today and how can we better do things and not perpetuate the same systems that exist. And I think in this is actually a very good thing. The working group that was instrumental in organizing the decolonization um, conference at Duke is basically here. They actually um, put together commentary that was published in 2021 in the British Medical Journal called Decolonizing Global Health Beyond Reformative Roadmaps and Toward Decolonial Thought. And this is a summary box of the article. And then basically, in this particular article, they discussed basically what they call the global health industry. And what they said is that the global health industry, which I showed you the picture basically showing the funding streams of where money is derived, where it goes through, and where it ends up. That is basically the global health industry as defined. It is by nature colonial in structure. And it is a power dynamic, and it's even more pronounced in the field than in the past. And so decolonization calls for complete overhaul of the colonial situation in the global health industry. And then also the global health industry priorities are determined by and for the richest and most powerful nations. For example, we can think of the situation in terms of COVID vaccinations. We can think about bilateral, multilateral institutions of global health structures. I think this in terms of thinking about philanthropic organizations and the outsized power of certain organizations and institutions in global health. For example, the Gates Foundation and who they tend to fund. For example, IHME. IHME has outsized influence in terms of its modeling, in terms of policymakers, even though it does some good modeling work, but although it is modeling. And so uh, but the most issue is that foundations like Gates and other foundations, which basically are private organizations that do not have any specific um, allegiances or responsibilities to any group or individuals, and answer to anybody other than two individuals, Bill and Melinda Gates, have a significant influence in terms of global health. And there is no transparency in terms of how they make their decisions, but they have an outsized influence in the global health agenda. In terms of their specific publication, they say that decolonization must address the pillars of colonialism, including white supremacy, racism, sexism, and capitalism. And in fact, equity and justice were not and currently are not the aim of global health. And those should be a part of global health. So it should be more introspective, engage the histories of so called social theory, including scholars, in terms of decolonization. So overall, decolonization requires a wholesale look at the history and move toward a more equitable basis in terms of thinking about um, how things are done. So, in many ways, they're advocating for greater voice in terms of individuals in low and middle income countries, addressing what the structures are and resituating the power dynamic. If we look at the flow of money in many ways in global health, we see that the flow of monies still that exists goes from actually um, northern countries to other northern countries who then do work in the global south, which is very dis- un- unfortunate and disempowering to individuals in low and middle income countries. When it comes to decolonizing global health, I start to think about foreign aid and I start to think about decolonizing global health from a lot of perspectives. Foreign aid is one of the perspectives that I look at. One of the books that impressed me in terms of foreign aid was Dr. Moyo's book, that was published in 2009, which critiqued the foreign aid structure of that it currently exists in terms of its approach to Africa. Dr. Moyo is actually a Zambian-born global health economist, and her analysis is on and speciality is on macroeconomics. She actually serves on the board of Chevron Corporation, Condé Nast, 3M, and she worked for 2 years at the World Bank and 8 years at Goldman Sachs before she became an author and international bestseller. And she actually critiques the global health financing system and shows through her work that the existing structures that are currently in place actually are detrimental to lifting people out of poverty. And in fact, they are not working for millions of individuals. And if our goal is actually to lift people out of poverty, then we need to change our approach. So, in fact, what I'm going to show is the next slide are a couple of things about her viewpoint and a couple of criticisms that she has received. So here are two clips, one discussing an interview with Dr. Moyo and her book, and a criticism from actually Bill Gates and on her book in 2013.
Zimbabwe's latest appalling chapter. It's a tragedy made even greater by the fact that this country once had one of Africa's better healthcare systems. No doubt many of you watching tonight would like to assist the people seen in our story, but what to do? Foreign aid has long been the world's way of responding to Africa's woes. But what if the aid is actually making things worse? Here's Europe correspondent Philip Williams with an interesting new take on a very old problem.
You've got to get on the phone and take the money out of your pocket. Don't go to the pub tonight, please. Stay in and give us the money. There are people dying now, so give me the money.
Appalled by the seeming indifference of the developed world, Bob Geldof and a group of celebrities got together to raise money for Africa.
The whole day down, 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 shoot it all down.
The result, of course, was the global broadcast phenomenon called Live Aid. The concerts raised millions of dollars from ordinary people around the world and marked the beginning of a new era of celebrity saviours who've been growing in authority, number and influence ever since. Enter African economist and author Dambisa Moyo, billed as the anti-Bono and with a provocative book called Dead Aid, a stinging critique of the so-called glamour aid. Moyo argues aid is not a solution, it's the problem.
I don't agree with the message. Fundamentally, I don't think Africa needs more aid. I think it needs less aid. It needs governments to be made accountable to the domestic citizenry and not accountable to donors. Africans stand in the hot African sun to elect their leaders. And it's those leaders who are charged with the responsibility of delivering social services and being accountable to their people. There clearly was a vacuum that has allowed the celebrity culture to seep in, but it would seem to me that no society would appreciate their whole policy and the future of their children to be dependent on celebrities that actually don't live in these contexts.
In 2005, Live Aid had become Live 8, and the frontrunners, the now Sir Bob Geldof and Bono, were taking their message directly to world leaders. But for Dambisa Moyo, the rise and rise of glamour aid is only part of the problem. She's also railing against what she describes as the self-perpetuating aid industry.
Basically, aid has become an industry. There are just way too many vested interests, and by and large, the criticisms that my book has been receiving are coming from those quarters, people who actually have a vested interest to see the continuous cycle of Africa in despair so that they can justify their existence.
What sort of people are you talking about?
I'm talking about academics, I'm talking about people from the NGO community, I'm talking about people who are policymakers and politicians who know that it doesn't work. The evidence has shown it doesn't work. In 1970, 10% of Africans lived in poverty. It's now more like 70%. In many countries, as high as 85% of Africans are living in poverty at a time when the aid model has become so dominant.
What's the solution?
In the book, I actually prescribe that with immediate effect, or in the very near foreseeable future, implement a 5-year plan where they systematically reduce aid to these countries. I would say that things like the capital markets are an easy way for countries to start to fund themselves. So, in the worst case scenario, governments in Africa should focus on getting ratings. They should be focusing on learning how to pitch to international investors so that when the markets do come back, which they invariably will, they'll be ready to raise money in the capital markets. But on the other hand, right now there are non-traditional markets such as China and the Middle East where money does exist, and African governments should be talking to these places about issuing bonds and raising capital that way.
As we've just seen in Zimbabwe, there is a desperate need for humanitarian aid. In response to the new power-sharing deal there, Australia's just committed $10 million to fight cholera and encourage medical professionals to come back and help. Beyond the humanitarian question, though, Dambisa Moyo claims the enduring problem is the scale of government-to-government aid, the large systemic cash transfers from rich countries to Africa. Huge amounts of money squandered by the likes of Mugabe.
In the book, I talk about the fact that the Zimbabwean government received from the United Kingdom and the United States around $300 million as late as 2006. And I think that's worrying. I think that's a big concern. The fact that Mugabe can and does come to Europe and the United States. I was just in New York last September, and he was attending the UN meetings. And the fact that the UK and the United States maintain diplomatic ties with Zimbabwe leaves the African on the ground wondering what options they have to bring their governments to accountability.
I suspect many people watching this program would say the problem's not aid, it's corrupt leaders.
Right. I don't think you can delink the two in the African context. I think an aid model makes good leaders bad and makes bad leaders worse. It's free money. There are no strings attached. Even in the times when multilateral institutions and donors have talked about conditionalities, those conditionalities are weak. They are not applied, again, because the aid industry, it thrives and feeds on Africans borrowing money, and so the cycle keeps going on.
Does it make you angry when you look at the amount of money that's been spent in Africa over the past 20, 30 years?
Well, I think it's absurd. In 1 year of a problem in the capitalist system, and we are so critical of capitalism, 60 years of an aid-dependent model, and we hear only calls for more aid. That, to me, is intellectual dishonesty, particularly from the quarters of people who I know for a fact have been big proponents of capitalism in other regions of the world. But when it comes to Africa, they're big supporters of aid. I think that,
what, is there a blind spot there? Why particularly Africa?
To be quite honest, I think it's built in pity. I think the whole aid model emanates from a pity for Africa, a sense that Africa cannot do it, cannot achieve growth. And sadly, because there are incentives, which, as you know, the world has shown, people, governments, companies respond to incentives. There are incentives for African governments to take aid. We've basically ended up in a situation where it doesn't work, and we're happy to just keep it going.
And you're absolutely confident that removing that aid is not going to leave at least some people without food, without medicine?
I think the ones that will be affected most will probably be the African elite, as opposed to the broader population.
What will they lose?
I think they would lose possibly their bank accounts in Geneva in the worst case scenario. But I think beyond that, I think that they would also lose the ability to have leisure time, and they'll be required to actually go out and start to work hard to find money to support their social programs in Africa.
What would you say, though, to the well-meaning Australian who donates to the charity, who urges the Australian government, for example, to lift its game with aid and go? What would you say to those people?
I would say it's very important to understand what that type of aid can and cannot do. It can provide a band-aid solution. So we've talked about humanitarian aid as one example of that, but it cannot deliver long-term growth that would ensure Africa to stand on its own 2 feet and become an equal partner on the global stage. So to give you an example, yes, you might help fund a scholarship for a girl to go to school, but when she's done with her education, the fact that aid is so pernicious and so damaging to an economy means that the economy has not grown, that girl that you've helped sponsor will not find a job in her economy.
If you cut off aid within 5 years, surely that's going to leave millions of people without the support they are now dependent on. Food aid, medical aid, aid that really keeps people alive?
I don't believe that's the case. Most Africans do not see any of the aid that you're alluding to. It's again, their at best case scenario in some projects is 20 cents on the dollar that actually makes it to an African, and that's best case. Effectively, if we continue down this path, we will have many more Africans living in poverty in few years to come, and that is really the problem, that there are no jobs coming out of an aid model.
And with the market reforms that you would advocate in that system, under that system, if it's widely adopted, what vision do you have of Africa?
The vision I have is basically one that looks like what's happened in the rest of the world when they've adopted those models. Growth rates that could get up to double digits, as we've seen in China and India and so on, and also much more participation by the broader African society, not only in terms of economic participation and entrepreneurship, but also in terms of political participation and ensuring that their governments are held accountable to deliver those services.
Let's hope you're right. Thank you very much for talking to us.
Thank you very much. And I am right.
Dambisa Moyo's book is called Dead Aid. And wouldn't it be interesting to be a fly on the wall when she finally gets in the same room as Bob Geldof and Bono?
Mr. Gates, Dead Aid, book by Dambisa Moyo, illustrates that giving more aid in Africa over the course of... Mr. Gates, Dead Aid, book by Dambisa Moyo, illustrates that giving more aid in Africa over the course of the years did not elevate poverty. Instead, it kept the economy crippled, with governments asking for more aid. This flow made a cycle of aid giving, which resulted in nothing productive, and it has not been used to solve the immediate, nothing except solving the immediate problems, and the money is not being used to make businesses sustainable in Africa. What is the Foundation's view in this regard?
So there's obviously a question about whether aid in Africa has had negative consequences. There's been new analysis about that.
Well, it depends on your value system. Over the last 20 years, the number of children who die in Africa every year has been cut in half. And is that good or not good? It's largely due to vaccines and the aid programs that have been there in Africa. I think that that book actually did damage generosity of rich world countries. People have excused various cutbacks because of it.
You read the book, obviously. Did you?
Yes.
Did you find anything? Did you find anything in it of use?
I found that she didn't know much about aid and what aid was doing, and she is an aid critic. There's not many, because it's moralistically a tough position to take, given what aid has been able to do. But if you look objectively at what aid has been able to do, you would never accuse it of creating dependency. Having children not die is not creating a dependency. Having children not be so sick they can't go to school, not having enough nutrition so their brains don't...
In the previous clips that I showed, in terms of talking about foreign aid and the fact that foreign aid is a big issue, and the fact that it is a colonialist mentality, and given that Dr. Moyo's history of working at the World Bank, understand how the World Bank operates and its mechanization, how it distributes foreign aid. And remember, previously we talked about World Bank and the global health system and its World Bank's lending practices, etc. And Bill Gates's criticism of Dr. Moyo and not actually addressing her criticisms, we can actually see that there is a significant conflict. And in fact, Bill Gates, in some ways, and his philanthropy is a part of the problem, and saying that it's a corruption issue. Well, there is a corruption in almost every government that exists in the world. So that's sort of a notion that is ridiculous to say. But I think that there is an issue that is to be understandable, in that in global health, there is a power dynamic. And I think Jerry Schiffman's commentary here in the International Journal of Health Policy Management, published in 2015, states it very well. Global health as a field of power relationships. And basically, it is a response to uh, other commentaries that have been published previously. And he basically portrays this very, very well, in which he says that you have to be skeptical of global health rationality projects in an effort to be rescue the field from aligned indignities of politics through application of scientific methods. You have to analyze global health as a field of power relations, um, and then also elevate the place of input legitimacy, and basically understand that this is a place of asymmetrical power dynamics in which the power really exists in countries that are this an asymmetrical power dynamic in which countries that exist in the north or high income countries, and they impose their will on powers or countries that are lower middle income countries, which are unfortunately described as countries in the south. And this is what decolonization is about, is resetting that balance. And as a person who comes from the north, who works in the south, you're automatically always in that power dynamic, whether you choose to accept it or not. Period. When we think about decolonizing global health, we need to think about the paternalistic attitudes that occur in the global health setting. We also think about the colonialist mentalities, the sexism, the racism, and all of these other isms that go along with global health. And we have to think about when we're decolonizing global health, we need to think about the diversity in terms of leadership. Because leadership is very, very important in terms of having, or in terms of moving the ball forward in terms of decolonization. Without leadership support and a diversity in thought, we will not be able to really move forward with an agenda of decolonizing global health. This article, in terms of thinking about that diversity in global health leadership, appeared in Forbes magazine in 2020, and actually March 8th of 2020. And it's very actually illuminating thinking about the lack of diversity in global health leadership. The next slide talks about actually the breakdown of the lack of diversity in terms of leadership positions in global health. So these statistics are from the Global Health 50/50 report, and unfortunately, they are startling. Global health needs to be more diverse. 70% of leaders in a sample of 200 global health organizations are men. 80% are from nations that are from high income countries. More than 90% were educated in high income countries. And the report basically concludes that, unfortunately, that they're neither fair nor fit for purpose. And the health and well-being of the people around the world will benefit from from and require a more diverse leadership. Unfortunately, only 5% of the leadership in global health is composed of women from low and middle income countries, and at least 50% of the population of the world is women. Gender parity will not be reached among CEOs for 40 years if current trends persist. I mean, for 40 years, this is a starting statistic. Over 83% of CEOs and board chairs are nationals of high income countries. And in fact, 50% of the leaders are nationals from two countries, the UK and the US. 38% from the US, 34% from the Europe. Only 17% of the leaders are from low and middle income countries, 3% from Latin America, and 9% from Sub Saharan Africa. Um, so, unfortunately, this is a very sobering statistic. So, this is why we have these issues in terms of global health. We do not have a diverse leadership or diverse CEOs or boards in terms of global health. We have a very undiverse population that's making decisions for people in places where these individuals are not very familiar with, other than taking trips um, to visit these locations. The problem with not having a diverse leadership is has become very apparent in terms of the Gates Foundation. So earlier this month, on October 6th, Tim Schwab published this piece in The Nation, and it's called "The Gates Foundation Avoids a Reckoning on Race and Power." And in this piece, he starts out by talking about Doctors Without Borders and how they faced a very major scandal in terms of how over 1,000 current and former employees signed a letter accusing this organization, a Nobel Prize winning organization, humanitarian organization, of institutional racism, citing colonial mentality on how the group's European managers view the developing world. And then it goes on to highlight that specific issue and draw a line from that and into the issue of the Gates Foundation. And I've highlighted here in purple. And it says such allegations would be serious in any field, but it deserves another level of scrutiny in the context of global health and humanitarianism. Two fields built on a paternalistic premise. Rich white people from wealthy nations setting themselves up as saviors of poor people of color. The assumptions embedded in this model have provoked increasingly popular calls to decolonize the sector, and many organizations have responded by invoking social justice rhetoric, claiming, for instance, that their work intersects with the Black Lives Matter movement. Now, this has been an issue that's ongoing. However, not all organizations have actually adopted this rhetoric. Some have adopted, some have not, and some have adopted with no intent on changing. Previously, I've shown you that in the field of global health, actually, the leadership of global health tends to come from high income countries are overly representative. Males that are represented that were educated in high income countries and tend to be white. So it's not by far any means representative. And this is a case study in terms of the Gates Foundation, in terms of what they're doing or have done, and how unfortunately that is not really benefiting a majority of individuals around the globe, even though they have an outsized influence in terms of the work they do in global health. The article extensively talks about the Gates Foundation and a lot of the issues with the Gates Foundation. So I'm not going to cover everything. So I would implore you to read it. The URL is below the image. So a few things that I'm going to cover here. There's an image in the article that shows that in terms of the Gates Foundation, the overwhelming recipients are in the wealthiest, whitest nations. So this is termed the global north, indicated here. So the majority of its funds go to United States, Canada, Australia, and other European nations or institutions in other in these four locations. And then about 11.6% go to institutions in the global south in terms of its annual funding. And in fact, it points to one particular spectacular failure that the Gates Foundation had in terms of COVID. So its leadership which is majority white compared to other leadership. And the article also highlights that, in fact, we don't have any diversity statistics on the foundation in terms of its makeup of its staff or its leadership. All we do know is some information about its board, and that's it. Everything else is basically secretive. There is no transparency in terms of the way the Gates Foundation is set up. So the article notes that the blind spots of the leadership became fatally apparent during the pandemic, and we're still in the pandemic, when the Gates Foundation positioned itself at the center of the global effort to deliver COVID vaccines to poor nations. This project failed spectacularly as the foundation partnered closely with pharmaceutical companies as even as the big pharma prioritized delivering vaccines to the most lucrative markets. Even today, many poor nations have no access to COVID vaccines, a situation that has been described as vaccine apartheid, which is unfortunate. So, in terms of, and these is just one of many unfortunate things that has been cited by the blind spots in terms of the COVID vaccination. And in fact, the Gates Foundation is still, unfortunately, refusing to engage in expanding the conversation around decolonization. And the article highlights some of the statements that have been made, and I think previously I've shown some of the statements. One statement that Bill Gates made in terms of Dr. Moyo, in terms of her book, Dead Aid. So there seems to be a very colonial, white privileged attitude towards the Gates Foundation in terms of listening to individuals from the global south who tend to criticize their viewpoint in terms of what the foundation may do. I think it would be beneficial if the foundation did listen to some of their critics, especially from the global south, because it would help the foundations do some of the things that it tends to do a lot better. In the context of the decolonization conversation, there is one poem that will come up in the conversation, and that is The White Man's Burden, written by Kipling. And this is author Joseph Kipling. The actual full title of the poem is The White Man's Burden, the United States and the Philippine Islands, which was written by Joseph Kipling in 1899. And this poem was actually written in terms of to talk about the Philippine American War, which exhorts the United States to assume colonial control of the Philippine people and their country. And this is actually a very poem that has chauvinism in terms of telling or encouraging the United States to really colonize the Philippine people and the Philippine islands. And in fact, this poem, which was written by Kipling is a very famous person. He wrote the Jungle Book. He was actually born in India. At that time, India was colonized by the United Kingdom, or England as it was known. So he's a very famous person, and you probably are familiar with some of his books and writing. He was a writer, poet, and novelist. So, in terms of this particular poem, it came out at a time in which, in within the United States, there was a significant amount of debate in terms of the United States, in terms of what the United States should do in terms of ratification of the Treaty of Paris. Senator Benjamin Tillman actually opposed ratification of the Treaty of Paris, and he read the first and fourth stanzas of the Kipling's poem on the Senate floor. However, his eloquence was unpersuasive, and the U.S. Congress ratified the Treaty of Paris on the February 11th, 1899, and formally ended the Spanish-American War and paid some sums of money to the Kingdom of Spain, and then they were able to annex um, the Philippine Islands. So this poem has been sort of a centerpiece, which started conversations in terms of the white man's burden, but many people have sort of interpreted as a burden that basically states that the white man has a responsibility to um, help people in other countries. But when you actually read the context of the poem, what the poem is saying is that the white man has a responsibility to civilize other people in other countries via colonization. So it is an imperialist poem, and in terms of white supremacy and for colonial empires. So that is the white man's burden in terms of this particular poem by Kipling. In terms of the Jovinism that has been espoused in this poem, other individuals have responded heavily to this poem because Kipling was a very famous individual at this time. So other people have responded in terms of the brown man's burden, the black man's burden, a response to Kipling, which was written at the same time in 1989 by clergyman H.T. Johnson. Take Up the Black Man's Burden by by J. Dallas Bowser. So there has been significant responses because, again, this poem received a lot of attention during its time. Although Kipling used the white man's burden to espouse empire, Jovinism, white supremacy, and advocated for civilizing other cultures through colonialism, other individuals have used the phrase the white man's burden as a more of an altruistic endeavor to help other individuals or to help countries to become more affluent, to basically lift up individuals. So, in this book, actually written by William Easterly, he talks about the white man's burden, not from the perspective of Kipling's poem, but the perspective of an economist in terms of thinking about how we uplift individuals in low and middle income countries from an economic perspective, and how that can be done to solve the ills of the world, including sort of reducing maternal mortality, reducing child death, and how those can be done from an economic perspective, and how that's actually beneficial globally, and how that can help in terms of sustainability. So he makes his case from that perspective. So that contrasts really with the Jovinism that has been espoused from the 1899 poem written by Kipling. So overall, even though the same phrase is being used, there's a different perspective that's being espoused from Easterly's book. And by the way, Easterly is actually a professor of economics here at NYU. So I would, if you have an interest in reading his book, I would say pick it up because it's a very, very interesting read. So there are various perspectives, and this perspective kind of aligns in some ways with Dr. Moyo's perspective in terms of thinking about the economic approach and criticizing the different structures that exist in terms of thinking about what has currently been constructed post World War II and how those constructs that exist from the various global institutions, and some of them are actually impeding the overall progress that's being made. That also ties into the fact that we do not have a lot of diversity in leadership at many of the global, at the majority of the global institutions that are in global health governance. So, in many ways, the things that we're trying to achieve in global health are not being led by the people that these policies will affect. So, the outcomes that we're looking for are not being achieved because the people that are really heading these institutions are not at the helm. I hope that you can appreciate now that in the field of global health, asymmetrical power dynamics exist, and that is what decolonization is about. And we have to address these asymmetrical power dynamics to really decolonize global health. So, a group of authors just published this in PLOS Medicine, in which they really start to describe what these asymmetrical power dynamics are. And this power and privilege is the elephant in the room that we are blind to, but we can all see that it's there. And they are basically these six things that are encapsulated. They include racism, they include patriarchy, the foreign gaze, in which many organizations and individuals operate through, coloniality, um, vestiges of white supremacy and white saviorism, as we've discussed in terms of the Bill and Melinda Gates Foundation and even other foundations, as we pointed out, even with the Nation article and the issues with Doctors Without Borders, the lack of diversity, equity, and inclusion, as we discussed with the leadership in the institutions and the global health organizations. All of these are issues within global health. And I think this picture really illustrates those concepts. And these are the issues that we're trying to combat in terms of thinking about decolonizing global health. And as individuals that work within the global public health field, these are things that we have to deal with on a daily basis. And especially when we come from the global north, we must understand that we are part of this particular system. So, the authors of this article have used the lens of COVID 19 as the view in which they discuss decolonization. And they have specific summary points here in terms of their view of how to decolonize. And I think they're very illuminating. Many of the authors are from quote unquote the global south, which I don't think is necessarily the best term to use. I disagree with that versus the global north. I think we can find better terms to use moving forward. But overall, I think that their view and their particular articulation of the argument in terms of the decolonization and thinking about how we can move forward and their understanding of the inequities, at least through the lens of COVID-19 pandemic, is very important and has been articulated by other individuals. One of the things that the authors indicate in this article is this phased decentralization approach. And they basically state, and this is just a summarization, is that we cannot reform global health without interrogating the very idea of global health itself and its underlying values and even its vocabulary. We need to understand the ways in which the colonial legacies deeply entrenched in national and global health systems impede the achievement of health equity. And the current global health landscape is heavily centralized and homogeneous. Global health remains much too centered in individuals and agencies in high income countries. That is true. All the institutions that are actually built to serve institutions in quote low and middle income countries are basically based in Washington, D.C., or in the United States or European countries. As we discussed before, we looked at the World Bank or many of these other global institutions, including the United Nations, etc. All of their leaders are come from either high income countries and they're based and located in high income countries within either the United States or Europe. So these institutions, of course, are beholden to the United States or European leaders and not to the individuals that they serve, which is a significant problem. So this phase decentralization uh, has to occur. Um, the question is, how does it occur? Because it has to occur with the acknowledgement of of stakeholders, including individuals in high income countries, and that is always the issue. One way of also decolonizing global health is to think about the legacies of schools in terms of the roles that they have played in colonization in terms of global health. Schools have an interest in decolonizing global health. And in fact, there are several commentaries that have been produced around the colonial legacies of schools in terms of um, the whole decolonization movement. So we have to examine the structures that have led to colonization, and we have to make sure that we're fully accounting for those in terms of this decolonization movement. So we have to think about the educational perspective. This lecture has talked a little bit about the decolonization movement, have provided sort of a surface level overview of that. But in order for us to move forward, we have to really think about the educational perspective. We have to search our own feelings in terms of the decolonization movement. Think about our roles in the decolonization movement. Think about our own power structure. What benefits do we get being that we're coming from the global north in terms of the schools that we're at and how we interact with individuals, and think about and question our own mentalities in terms of the power structures that we exist in and the frameworks that we are operating in. I will end with this opinion piece, which was published on NPR on December 30th, 2019, from Dr. Karen, who's actually at Harvard. And in that piece, he talked about his own experience. He's a medical doctor, his own experience working in a low and middle income country, and how he talked about just sort of doing those rotations in which he parachuted in for a certain length of time and then he left, and how he felt working in that environment, and how that feeling left him with a significant amount of guilt, understanding that he could not, in many ways, really alleviate as much suffering as he could, understanding that he came from a very privileged background and seeing the suffering of those individuals, and coming to eventually realize the system that he was working in and the unfairness of the system in terms of it. And in this piece, which I very encourage you to read, the URL is below, he basically states that any Western institution more than a century old and which claims to stand for peace and justice, has to confront the painful truth that its success was built on the savage legacy of colonialism. And that is a significant viewpoint in terms of he talks about just that whole legacy and how that legacy is intertwined in medical education. And that legacy is also intertwined in terms of public health in many ways. In many of these institutions that are over a century old, in fact, within the United States, there are so many stories in terms of just the lack of equity that has occurred, just both within the United States and also outside of the United States in terms of people and the global around the globe. So this is the environment and the context that we operate in, and we have to acknowledge that legacy. We cannot operate in an ahistorical manner anymore. We do not have that luxury anymore. That is what the decolonization movement is about. We have to acknowledge that, accept that. It should not stop us from doing what we need to do, but we need to be sensitive to what the environment is, and we should not perpetuate the system and the inequities that have existed for the past 100, 200, 300 years, but seek to resolve and remedy those issues so that those inequities do not keep on self-perpetuating itself.